Welcome and thank you for joining the Williams Institute for a discussion about food insufficiency and transgender communities, innovative strategies to improve access to food. Introducing our moderator and research director, Kerith Conron.
Thanks, Anthony. Welcome, everybody. We are so happy to have you join us today for a discussion about strategies to reduce food insufficiency among transgender communities. We are joined today by a wonderful group of people who have so much to share with you. And this group includes Bamby Salcedo, President and CEO of TransLatin Coalition, Moses Viveros, Community Pantry Food Manager at Race-Based Alliance in Chicago, Bria Berger, Research Manager at Feeding America, Bianca Wilson, Rabbi Zacky Senior Scholar of Public Policy at the Williams Institute, Olivia Hunt, Federal Policy Director at the National Center for Trans Equality, and Katie Ettman, Food and Agricultural Policy Manager at SPUR, a civic planning organization in the Bay Area. Thank you to our panelists for joining us today. To the audience, what you can expect from us is a guided discussion. You'll hear from each of the panelists fairly briefly for about 40 minutes. We'll have Q&A for about 10 minutes from folks in the audience and with the full panel. Then we'll have some concluding remarks in the group. And please know that most people on the panel are willing to have some follow-up conversations, since many of you who are here today are really interested in moving strategies forward. So this is the beginning of a dialogue. It doesn't need to be the end. And with this being said, I'm going to bring our first panelist up to the stage. And this is Bamby Salcedo. So Bamby, thank you so much for joining us. You are the founder of TransLatin Coalition. You provide many different kinds of services to the community of LA, including meals. Can you tell us about meals? Why do you do that? Why does TLC offer meals and other food supports to its clients?
Bueno, primero que nada, quiero dar gracias a mi poder superior y por darme la oportunidad de vivir un día más. Y también quiero honrar la tierra en la cual estamos. I know that it was hard for some of you to understand, but I always introduce myself in my native language before I speak. So I gave grace to our creator, who I chose to call my higher power. And I also honor the land where we're standing on. I'm greeting you from Tanggaland in Los Angeles. And so thank you so much for being here, for the invitation, Kerith. Well, I think the answer is simple to your question. The reason why we give food to our community is one, because that's something that is essential in people's lives. And we do it also because we have a responsibility to our people. We are the biggest trans-led organization here in Los Angeles. And part of the work that we do is to really uplift transgender, non-conforming, and intersex people. And so when we believe that when we provide people with the basic things that people need, that is a way of empowerment, right? And so food, it's one of those things that help individuals obviously nourish themselves and just, I guess, eliminate some of the stressors that we as trans people continue to experience every day. And so, I think our commitment to our community, obviously, it's clear. Even through this global pandemic, we remain open. And one of the main reasons why is that because when the world shut down, we wanted to, even if it was food, to at least give that to our community. And so we wanted to make sure that through even if it's just one meal that we provide to people, it's one less thing that they need to worry about for today. And so we give lunch every day. We try to provide nutritional meals to our community. But the work that we do, it's, there's multiple services that we provide here, but obviously having food on a daily basis, particularly to those who may not have access to food, or even to those who have tried to have access to food banks, traditional food banks, to where oftentimes are excluded. I think it's also important to recognize that a lot of food banks are religious based, right? And so when it comes to our community, right, like we cannot hide who we are, right? Versus, someone who may be a gay man, for instance, right? Like they cannot show that they're gay, right? Simply by looking at them. Versus, transgender non-conforming individuals, we are what I would call visibly trans, right? In other words, we can't hide who we are, and just, we get discriminated simply because of who we are. And so for us as an organization, it's important that we provide our community with, even if it's just food. I think you're muted.
Thank you. I've had the chance to be at TLC, and the space in the kitchen is very warm and inviting. It feels like you're part of family or community when you're having lunch at TLC. How do you support this program? Who funds you to provide the service?
The majority of the funds that we get for this meal program specifically comes from donations that people gave us. However, we do have a little bit of support from the city of West Hollywood. We have a small contract with them, specifically supporting and feeding residents of West Hollywood who are trans. But the broader funding from, for this particular program, it's funded by people who believe in the work that we do.
Thank you, I appreciate that. Let's hear from Moses Viveros next in Chicago, another trans service organization, Brave Space Alliance. Talk to us about what you're providing. You created a food pantry for community members. What motivated you to create this program?
Of course, thank you so much, Kerith. It's a pleasure to be amongst all of you today. So just a quick introduction again, my name is Moses. I use they, them pronouns. I am currently the Community Pantry Program Manager at Brave Space Alliance. For those of you who aren't familiar with who we are, Brave Space Alliance is a Black trans-led LGBTQ center in the Hyde Park neighborhood of Chicago, which is on the city's south side. Like I mentioned, as you can tell by my title, I oversee all of our pantry programming that we offer here. So basically, Brave Space Alliance aims to provide expansive resources and services to BIPOC, queer, and trans communities in Chicago. We recognize that this community in particular has been deprived of life-sustaining resources and opportunities to connect with members of their own communities. So our community pantry originally started as the then named Crisis Pantry, which was a response to the increasing levels of food insufficiency brought on by the COVID-19 pandemic. And additionally, we recognize that many existing resources and sites that provide food aid aren't necessarily equipped to meet the needs of queer and or trans BIPOC community members. So like, as Bamby has said, it's not uncommon to hear of QT BIPOC folks experiencing racism, transphobia, homophobia, and other conditions that threaten their livelihood and ability to access life-sustaining resources like food. So in creating our pantry programs, we built these programs off of a mutual aid framework, which is predicated on the idea of neighbors helping neighbors. So we aim to make our community members a key part in every operational aspect of our pantry programs, from determining the locations that we work in, the types of food that we procure and redistribute, and then also how we redistribute it. As a result of these efforts, we've been able to create our community pantry, which hosts different programs. One of them being a home delivery program, which provides a free grocery delivery service that prioritizes immunocompromised, elderly, and or disabled community members. We also recently rebranded our pantry at our home office as a free store pantry concept, which basically allows community members to come in and shop for their products. So they're able to pick whatever items that they need right off the shelves. And then we also offer also partner with 4 other social services organizations across the city of Chicago that help us to provide pantry services to communities beyond our office at Hyde Park. And we're very intentional in choosing who we work with for these pantry partners. So all of our pantry partners in our network right now are also social services organizations in their respective neighborhoods. And we chose these organizations specifically because they have built up a reputation for themselves in their own communities as spaces where people can get resources in a culturally affirming and competent manner.
Moses, thank you. I'm going to share a few slides now, some of the backdrop of what we found looking at some data collected during the pandemic by the U.S. Census Bureau. I know that Brave Space Alliance and also TLC have been providing food support to trans folks for many years, and it predates the pandemic, but the pandemic certainly provided an opportunity to study this issue in a little bit more depth. So the Williams Institute was able to gather some data from the Census Bureau about experiences of the pandemic in the population. And for the first time, the Census Bureau included questions that would make trans folks identifiable among survey respondents. So we were able to look at what was going on for trans versus cis folks related to having enough food to eat in the prior week. And what you see here is that at least 1 out of 5 trans persons said that they sometimes or didn't have enough food to eat in the prior 7 days, as compared to about 8% of the cisgender respondents. This is what the USDA folks would call very low food security. And while it's the most problematic and the focus of our panel, it's also important to note that a number of people also said they had enough food, but not always the kinds they wanted, which is a less severe, but another form of food insecurity. So stepping back, only half of trans people said they had enough food of the kinds they wanted. So we have a significant issue with inadequate resources for trans folks related to food access. When we looked at data about why people didn't have enough to eat among those experiencing food insufficiency, as you would expect, most people, trans and cis, said it's because they couldn't afford to buy more food. Where we do see some differences, trans people were more likely to say they couldn't get out to buy food, and they were more likely to report safety concerns as barriers to having enough food to eat. If we report some findings collected by the National Center for Trans Equality on the US Transgender Survey, we see that trans folks are very likely to report high levels of disability compared to the US population as a whole, particularly disability related to doing errands on their own. So the findings that we see in the Census Bureau's Pulse survey are consistent with what we've seen in other surveys about the trans community. So when we looked in this data set about reported possession of SNAP benefits by the survey respondent or another household member, and we look at levels of federal poverty related to eligibility criteria for SNAP benefits, we see that less than 1/3 of people who are income eligible for SNAP benefits reported having these benefits. And we see that some people at higher levels of poverty or better economic levels also report SNAP benefits. And that's because there are some other eligibility criteria for SNAP. But what we see here, at least in this first bar, is that lots of people who are income eligible are not currently enrolled in SNAP. To sort of reinforce some points that both Moses and Bamby made earlier, we see that transgender people of color are much more likely to report food insufficiency. The gray bars are the ones we're interested in here. More than 1 out of 4 transgender people of color said they didn't have enough food to eat when they completed this survey in the summer and late fall of 2021. This is about twice as high as what we see for cisgender people of color and transgender white people, and is much higher than what we see for cisgender white folks. So at this moment, we're going to turn our attention to Bria, who works at the Feeding America food banks. SNAP benefits are certainly one way to improve access to food. Access to charitable food resources, of course, is another significant avenue, and one that has been utilized less often by trans folks for reason outlined by Bamby and Moses. People have had negative experiences. So Bria, what can we do? What can we do to improve access to food? Thinking specifically about some of the challenges that we identified on the Census Bureau's pulse survey.
Sure, thanks, Kerith. Hi, everyone. My name is Bria Berger. Pronouns are she, her, and I am a senior research manager at Feeding America and a member of our Pride Plus Progress employee resource group. First, just a little bit more about Feeding America. Feeding America is the largest hunger relief organization in the United States. Through a network of 200 food banks, 21 statewide food bank associations, and over 60,000 partner agencies, food pantries, and meal programs, we helped provide 6.6 billion meals to tens of people in need last year. Feeding America also supports programs that prevent food waste and improve food security. We bring attention to the social and systemic barriers that contribute to food insecurity, and we advocate for legislation to prevent people from going hungry. In terms of the question about food access, we know, thanks to your research and many others, that trans people are more likely to live in poverty compared to cis people, which brings challenges in transportation and food access. One solution to increasing access to food for neighbors in need is a technology solution called Order Ahead. Order Ahead is a technology solution, that enables neighbors to order food from a food bank or agency and pick it up at a convenient location, including drive-through or refrigerated locker, or have it delivered. Order Ahead expands access to charitable food through a discreet and convenient ordering system that reduces the physical and social barriers met by people facing hunger. This program is available to all food banks in the network, and they can also offer it to their agency and pantry partners. Currently, 29 food banks have used or are currently using Order Ahead, and several more are in the onboarding process. So far, we've heard extremely positive feedback from neighbors using Order Ahead, and in the future, we hope to include application assistance and other supports for things like SNAP or case management, integrating that directly into the app.
Thank you, Bria. At this moment, I'm going to turn the stage over to Bianca. Bianca is a scholar of poverty and has done research on food insufficiency. Bianca, were you surprised by the level of food insufficiency that we identified in the pulse data?
Yeah, I mean, I think what we see in the pulse data that you presented is, really a symptom of what we know about LGBT poverty, as Bria mentioned, and also, in many ways, both Moses and Bamby spoke to, that, we know LGBTQ folks as a whole are experiencing high rates of poverty, but trans folks in particular experience very high rates. And, also reflecting what you presented on food insufficiency and food insecurity with regard to race, we know that, that again is a symptom of the same patterns that we see in terms of poverty. So on the next slide, you'll see, rates. So among, and these are national rates here. So percent living in poverty among trans folks, while everyone has particularly high rates, the highest are among the people of color. And here statistically, the people of color represented are similar. And all of them are significantly higher than white trans folks. So it's not surprising given what we know. Food insufficiency is really about not having the money to buy food and not having the resources to attain, keep, and prepare those foods. So, if it really comes down to income in many ways, what we see around food insufficiency is reflecting income and poverty. And then, just providing a little bit more context, these graphs here, just in two languages, but it's the same graph, reflect some of our overall findings from a study we did of 2 counties here in California, one urban LA and less urban and also rural Kern County. And we identified many of the factors that that our folks here are talking about. And in terms of, and when we talked to LGBTQ people about their lives, their experiences with poverty, and about their childhood. And for many, including trans people, and particularly trans people of color, we see that a lot of their experiences with economic instability and their vulnerability to food insufficiency really started with childhood. So that's why you see one side of the graph here, thinking about a framework of LGBT poverty, first locating that in intergenerational poverty and really grounded in structural racism, and that's important to keep in mind, and anti-immigrant bias. But also, as you can see, some LGBT people, especially many of the trans adults in our study, talked about rejection from parents as really the beginning to poverty and that vulnerability to food insufficiency. And that was a starting place, really losing the family resources that are needed for survival. And this is particularly significant for many of the gender minority folks in the study, particularly again for white trans people who grew up middle or upper class. And again, that's not all white folks in the study. Of course, there were Black, Brown, and Indigenous folks that were also grew up middle and upper class, but it was disproportionately, racially divided there. Yeah.
Thank you, Bianca. I appreciate that context. At this time, we're going to turn the stage over to Olivia from National Center for Trans Equality. Olivia, we're talking about public benefits as a way to one strategy to help reduce food insufficiency. Talk to us about identification. How many people, transgender people, have IDs that have names and gender markers that match their gender presentation? And what's the issue with getting IDs? How does it relate to public benefits? You and I have talked before, and I know you are the person who understands how all of these things are connected.
Thank you, Kerith. Yes. By the way, to start, my pronouns are she and her. So yeah, ID document updates are one of the major obstacles for a lot of trans people going through their legal and social transition and their medical transition as well. The first thing to understand about that is that changing the name and gender markers on documents and records isn't an all or nothing process. There are some documents, for instance, that are bureaucratically difficult or impossible to update. For some states, for instance, it's utterly impossible to make changes on a birth certificate. Others make it incredibly easy. Lately, we've seen a trend of a lot of states making it simpler to update their driver's licenses, to update birth certificates. We've seen the federal government move to making passports easier to update. So while that's changed the framework for trans people throughout a lot of the country, there are still some states that are tightening the rules and making it harder for people to make changes to their identity documents. So the rules for changing your documents aren't the same for every person. Sometimes obtaining a gender marker change on a driver's license or a birth certificate requires obtaining some sort of transition-related surgery, for instance. That's incredibly expensive, it's incredibly invasive, not something that everybody wants, not something that everybody can afford, and some people are medically barred from obtaining it. So for instance, states that have that have effectively permanently barred people from being able to update their birth certificate or their driver's license if they're not able to obtain transition-related surgery. As a result of this, having inconsistent information across different documents and records is really the rule rather than the exception for trans people. Having a different set of information on your birth certificate versus what's on your social security record versus on what's on your driver's license happens to more trans people than we really even have been able to properly tally, just because some of these pieces of data are buried so deep in the information sphere that it's impossible to find the information that we really need to categorize it. On top of that, old information is sometimes easily visible on a record. So even if a record has been updated, someone might be outed just by the process of accessing that information within a system, because it will just say previous names and list them under there. And if those names happen to typically be associated with a different gender than that the person is presenting as right now, that effectively immediately outs them to the person they're interacting with. In our 2015 US Transgender survey, which Kerith mentioned earlier, we learned that only about 11% of respondents had their chosen name and the correct gender marker on all of their IDs and records. 68% of people reported that none of their IDs and records had their chosen name and correct marker on them. Only 30% of the people who responded had completed a name change through the court system. And only 44% of the ones who were trying to update their license or ID had been able to change their name. Only 29% were able to change the gender. So trans people presenting with documents that do not match how they present themselves to the world is incredibly common. There are other obstacles and stuff, as I mentioned, some of the bureaucratic problems earlier, but one of the biggest obstacles that comes up is cost. 34% of the people who've changed their name spent over $250 to do so, and 11% of them had spent over $500. People who live in Virginia have it generally pretty lucky. Here, a name change costs about $35 to $40 and doesn't have any hidden fees like a publication requirement. If you change your name in Utah, though, it can be well over $600 or $700, depending on where you live and what paperwork you have to file. So folks who are already struggling with poverty, dealing with accessing public benefits, are probably not going to have the resources to immediately delve into changing their name and updates, which can trap people into a system of being outed as trans because of their identity documents, being denied services, being kept within the cycle of poverty. Now, consequences for not changing your name on your document, being outed casually, that just sort of sounds like it might be a minor inconvenience in a lot of people's minds that, oh, well, they've learned information about you that you don't want, but it has real consequences for trans people's lives. 25% of trans people who presented an ID that had a name or gender marker that didn't match how they present themselves were verbally harassed during that transaction. 16% reported being denied services or benefits. Nearly 10% were just asked to leave an establishment or office, and fully 2% reported being physically assaulted just as a result of showing their identity documents. So trans people tend to avoid interactions with authorities and government offices, and that leads them to shy away from taking advantage of public benefits like SNAP that they might otherwise be eligible for. So, sorry, go ahead.
Olivia, is there anything that SNAP programs can do about ID requirements to facilitate enrollment? Like a lot of what you said has implications for training, right? Training of staff, right? But what are some, beyond that, like what are some practical things that programs can do about those ID requirements?
So that gets really complicated because it comes down into how rules, regulations, and statutes are written. Because there's not really a concrete definition at the federal level for what constitutes someone's legal name, and I emphasize the air quotes there. As a result, there's not often anything that interferes with various offices and programs using a chosen name, using the name a person wants them to use to refer to them throughout the entire process. And really what SNAP offices could be looking toward doing is using chosen names, emphasizing that in all situations where they're not programmatically or statutorily required to use the name that is printed on a specific ID document. There's a lot of flexibility in the way that names are used. We tend to think of it as being a very concrete, reified thing of you have exactly one legal name that always looks and is spelled the same way. And really, it doesn't work that way. There's a lot of flexibility in how we treat names, both in interactions and in record keeping. And unless there's a specific requirement imposed by statute to use a name as recorded on, say, a government issued real ID compliant document, there's not really a barrier to exposing that or to using that flexibility and using that to make people feel more welcome and more accepted to the program that they're trying to access. On top of that, simplifying document and record updates within SNAP systems is probably one of the easiest ways to make this more accessible for folks changing their name. If you make somebody prove their name change with 17 different forms of identification showing an updated social security record and updated this and that and this and that, it's just going to turn people away and make it really difficult for folks to actually access that if they haven't been able to change their name in all of their documents. It's that same problem of inconsistency is the rule, not the exception. And when we expect it to be the rule before we'll change some of the information on another record, we're effectively just making one more place where they don't have the correct information, but so we're locking them into that area of just not having their name reflected across documents and not having enough ways to prove it to other people that they've updated their name. And then one of the best ways that SNAP offices could try to simplify these problems and do a bit of community outreach is partnering with local organizations, trans organizations, legal clinics, other providers who do pro bono work around identity documents. That's something that's not available in every community, but many have them. In a larger metro area, for instance, there might be an LGBTQ focused medical legal partnership, a clinic that has a law office within it that provides free identity document services. Rural areas and smaller towns, there might be a local legal aid provider that, again, it's not something that's advertised because it's not something that everybody looks for, but name changes are an incredibly common thing for lawyers to do. In smaller towns, you might be looking for just a local law office where, because again, name changes are usually so rote and straightforward, they just do name changes for free for folks who come in and have financial need. I've worked for several of those in a couple of different locations before I moved into the nonprofit world. And then finally, if there's a law school nearby, law students love the opportunity to go out and do clinical work, to actually work with clients in the field. And so partnering up with a law school clinic to provide the service to somebody who is trying to come into a SNAP office and update their record will help them update their records. It'll also create a connection so that folks who are going to these providers who are helping them to update their identity documents are also connecting them back to SNAP and making them aware of their eligibility and connecting them with the folks who can help them get registered. So that benefit that they were eligible for, that they'd previously been shying away from because it seemed so inaccessible, is now being made more accessible by partnering up with trans-friendly organizations.
Olivia, thank you so much. That is incredibly helpful. I see somebody in the audience I kind of want to call up to the stage, Alana Redfield. Alana is Director of LGBTQI Affairs in the New York City Department of Social Services. And New York City had a great initiative to enroll LGBTQ people in SNAP. So Alana, I'm wondering if you can join us and just tell us a little bit about that initiative, like what can a municipality do? Anything you can tell us about how New York City addressed ID requirements for SNAP? I see somebody in the chat was asking about non-citizens and ID. So please, tell us about New York City and what you all have been doing.
Thank you so much, Kerith. I'm happy to jump in. I think many jurisdictions across the country have been operating for a long time with a scarcity mindset when it comes to resources like SNAP. And our administration actually really tried to sit down and talk to leaders like Bamby and Moses and Olivia and try to hear those concerns to try to reduce barriers to enrollment in our program. So our agency administers programs like SNAP as well as cash assistance and other benefits that can help support people. So as part of that, what we had done is actually try to look at where are all the various barriers that prevent people from either starting an application or completing an application for SNAP in particular. And one of the big changes that we've done, and I know other places have done this too, is to actually move to an online application system. So where in 2013, before this administration or the prior one, around 23% of people enrolled in SNAP through online application. And then by 2020, in the beginning of the pandemic, that was up to 99% of people. So that in and of itself really helped make a difference in reducing barriers and also reducing some of those negative interactions. I think Olivia mentioned some of these that can come up when trying to apply for government benefits or trying to establish what is necessary to do that. We also really tried to partner with community organizations to both promote services and programs like SNAP and let people know they could be used on things like fresh food at farmers markets. And we did that through we created an LGBTQ advertising campaign with amazing LGBTQ community members. And then we blasted it through dating apps and through like gay publications, LGBT publications during Pride Month, and really tried to like normalize that conversation whenever people are like looking for an event or looking at these resources. They were also seeing you can click right there and apply for SNAP. We also recognized during the pandemic that so many people were struggling with the issues that Bamby especially named earlier, and Moses around not having resources that they felt like would be welcoming or supportive to access basic needs like food. So New York City has some amazing mutual aid organizations that started, but we also tried to really recruit food pantries and other community-based organizations to self-identify as LGBT affirming and to try to create a welcoming space that way. We even created a list on the city's website of LGBT affirming spaces or self-identified LGBTQ affirming spaces. The last thing I mentioned to the last question that you asked around IDs is that New York City does have a municipal ID, which is far more available than other forms of government ID, particularly for people who are undocumented, people who are homeless, and people who are transgender. Those are some of the three key groups that that advocated for and in many ways benefit from the municipal ID. So we are able to use that ID to help people access some of the benefits and set up more economic stability. So I think it's a really good model, and I think a lot of places have municipal IDs. That's one way to make accessing these services more accessible.
Lana, thank you so much for jumping in and sharing that information with us. I'm now going to call up Katie Ettman from SPUR to talk about Medicaid. How can Medicaid be helpful to improve access to food?
Thanks so much, Kerith, for the question. And before I hop in, just once again, Katie Ettman, my pronouns are she, her, and I work at SPUR. We are based out of the San Francisco Bay Area. And one of the ways that SPUR frames some of our work around food insecurity or food insufficiency has to do with thinking through the safety net. And today, lots of my co-panelists have spoken about SNAP, which we call CalFresh in California. We haven't yet touched on WIC, but these are some of the federal level food resources we look to. We also look to the Feeding America Network and all of their partner food banks and pantries to meet the needs of those who might not have access to things like SNAP and WIC. And so when we think about the universe of that safety net, we think about improving it in really two ways. One is to tighten the safety net. So to make sure that when people fall, they don't fall as far. So how do we improve the benefits that people have access to so that they better meet their needs? We also think about not only tightening the physical net, but making it wider. How do we catch more people? So in California, that might look like making sure that folks who are undocumented have access to food resources. So a sort of state level version of SNAP. So these are different ways to make sure we're reaching all of the populations who need support. And so the one that I'll dive into right now, Medicaid, we are thinking about that, tighten it up, make it a better benefit. And so what that has looked like in California is I was really fortunate about 2.5 years ago in coalition with a number of other Bay Area based nonprofits. We put together a coalition advocating to make food-based interventions permanent healthcare benefits. And so those food-based benefits, we came up with an overarching term that we call medically supportive food and nutrition. And that is an umbrella term that covers 7 different food-based interventions. So one of those is medically tailored meals. So that's the idea that a registered dietitian nutritionist puts together a meal plan. It gets prepared for a patient's individual needs. So maybe someone's released from the hospital, can't make their own meals and needs them delivered to their home. But it also looks like things like produce prescriptions. So you get a voucher from your healthcare provider, and then you can go to a retail environment and get free fruits and vegetables. It could also look like a food pharmacy, so that when an individual is visiting their local clinic or their doctor's office, there's actually an on-site food pantry that's set up that you're also going to get to talk with someone about your food choices, maybe how to prepare them. And so all of these different food-based interventions are ways to improve people's health and save the healthcare system dollars. And so when we first came to this idea that we wanted to move from pilot services where individual nonprofits were providing these in medical settings, but they were being paid through philanthropy, and realizing we wanted to transfer them so that the healthcare system was actually paying for them, because that's really, it benefits the patients, but it also benefits the healthcare system. And so together, a coalition of a core group of 15, but a larger group of 100 organizations across California asked the Department of Healthcare Services, who oversees our Medicaid program, so health insurance for low-income folks, which we also call Medi-Cal in California, because we rename everything. We went to them and we said, hey, you should include medically supportive food and nutrition in your upcoming waiver. And what that waiver is an ability for the state government to ask the federal government, particularly CMS, the Center for Medicare and Medicaid Services, for exemptions to Medicaid rules to test out and pilot new and innovative ways to provide care. And so that's what we did. We said, here, Department of Healthcare Services, you should include these food-based benefits. We know that they can support our Medi-Cal population. I'm really fortunate to say that after about a year of advocacy, that was included in the state's Medicaid waiver. And then as of December 29th of 2021, that waiver was approved by the federal government. And so what that means is now individuals who are eligible for Medi-Cal in California, which is more than 13 million Californians, will have the opportunity through a particular mechanism to have the potential to access these food-based resources. And so one of the reasons that our group has been incredibly supportive of this umbrella term of medically supportive food and nutrition is that we want our healthcare providers to be able to target the correct intervention to the right person. And I think that really speaks to the flexibility that folks have talked about here today. If there is an individual who is, say, food insecure and maybe possibly dealing with diabetes, and they're like, oh, I'm totally capable. I want to go to the grocery store and pick out my own food and prepare it at home, that works for me. Then a produce prescription might be the right fit. But say it's an individual who is dealing with a chronic disease, maybe something like a renal failure condition, like, oh, not in a position to make your own meals, to go to the grocery store, whatever those benefits might be, to make sure that maybe you need a home delivered option. And so we wanted to make sure that this full spectrum of services was covered, and we're really excited to see that get implemented here in California. The last thing I'll say about why we wanted this broad spectrum is it's really a way to make it culturally relevant. You can make sure that the food that people are getting is the food that they want and that works for their bodies and their lifestyle and what they prefer. And then we also want to make sure we always uplift the health outcomes that are associated with this. So we're talking about reductions in average blood sugar, so an indicator of diabetes, reduces in blood pressure. We also have some studies that support that it reduces preterm birth rates. So there are lots of different ways that we know that food as a baseline is important to your overall health. And then I feel like the cherry on top is that it can save healthcare dollars. There is a study that estimates federally, if we put a 30% subsidy on fruits and vegetables for those who need it, could save $40 to $100 billion federally. That's with a B. It's a lot of money. And that's what happens when we look to upstream interactions and look towards food as a way to really improve our healthcare over the long term.
Thank you. Thank you for that example of yet another strategy that states can employ to try to improve access to food for marginalized populations. At this point, I'd love to call all the panelists back up to the stage. I think there have been some amazing ideas and suggestions that have come up through the course of remarks, including reducing barriers to benefits enrollment through reducing interpersonal contact with people who might not be trans competent or trans friendly through online applications, partnering with trans-led organizations in lots of different ways, including facilitating access to changes of identity documents, trying to increase access to charitable food resources through delivery programs like Feeding America is rolling out, supporting trans-led organizations and providing meals and food resources to trans community members, using Medicaid as a resource. I'm sure there are additional strategies, but the menu here is fantastic. I want to think a little bit, though, also about financing and supporting this endeavors, particularly for trans-led organizations. I think you're often asked to kind of go out and educate other people and to provide support to other organizations. Bamby and Moses, what would it take for you all to, help your clients enroll in SNAP, to partner with local organizations that provide traditional resources? What would it take for you to do that without, further depleting your own resources?
You want to start, Moses? Thanks. Well, so, so we currently are not enrolling people in SNAP, one, because we don't have the capacity to do that, right? But we would if we get the resources, right? But I think further, I think what we need to do is actually to, for this institution to change their policies, for these institutions to change, the way they do things, right? Because it is a government or systemic issue, right? Like when it comes to like TGI people and obviously their documents, right? And so I think we need to, just really change the system, right? Like to be inclusive of people. Perhaps one of those could be, just having an added gender marker, right? Because right now it's just M and F, right? And so I think it'll be an opportunity to sort of like systemically change that so that people are aware who people are. Not only that, but it will help capture data on people who access that service, right? Because even if we go to those places, right, like we're still invisible because, our experiences are not captured. So there, I think there's a multi-layer approach that needs to happen. One, investment in organizations like ours that really support the community directly, right? Because even if we send people to like the GR office or, the social services office, right? Like oftentimes people don't have good experiences at those offices. So it definitely would be a benefit if we could do that kind of work, but we also need to be funded to do that work, right? Because it's just hard. Like we support a community to the best possible way, but then again, it's just too much. We definitely need the resources to support our community, the best way that we need to be supported. And I also want to say that there's another issue that we're not talking about, and that's the issue of elderly trans people, right? Which is just another, a whole other issue. Because as we know, elderly trans people are not being supported the way they need to be supported just in general. And so food is definitely one of those things as well. So I just wanted to mention that.
Thank you, Bamby. Moses?
Yeah, thank you so much, Bamby. We're also similar in that regard that Brave-Based Alliance is currently not offering assistance with SNAP applications due to, one, a lack of training for our staff to just like be better equipped to help people with their applications, and also just like capacity. Right now, we just hired on another staff member, but even though with that additional staff member, we're still very, at capacity in what we could do in our week to week. So, if we were able to get additional resources to train our staff and also just have more time to sit down with community members, I think it would be a really great opportunity for us to be able to assist folks with their application and just accessing other government benefits. But, I also really agree with Bamby that, SNAP isn't, there's a lot more systemic change that needs to happen in order to increase food access for trans and BIPOC overall. Sorry, my AirPods just died. Can you also hear me? Okay, perfect. And it's just like, I really wish the answer was as simple as like, just, get more people access to SNAP and, just like participate in trainings and so you could become more competent around trans and LGBTQ issues, but really it's much more deeper than that. It's just like, especially with like, resources such as SNAP and other government benefits, there's still a lot of stigma around folks that use these benefits. I think one of the lingering effects from the Reagan administration is this notion of like the welfare queen, which is, a deeply racialized stereotype that a lot of people like don't want to be associated with. And I think that's coupled with, government like SNAP in particular not being enough to cover a person's monthly food needs, and also just being difficult to obtain and also just maintain eligibility for people. I think that's one of the reasons that we see a huge disparity between people who are technically eligible for this program but don't actually apply. So I think if we really want to increase, make SNAP a more viable option for trans, queer, BIPOC folks, we really have to just change the way that we look at food access, how we get people food access, and just, it's an overall societal shift in the way that we approach and assist folks that do need this additional assistance.
Thank you. We've had a few questions about serving particularly marginalized community members. So trans youth, trans elders, and non-citizen trans folks. And if folks on the panel have experience trying to do outreach or provide service to these particular communities, that would be wonderful if you could share that. Bamby, is that one that you want to take? Just thinking in particular, you know, the diversity of people that you serve who are Latina in LA.
Yeah, I mean, you know, we are very, very honored and lucky that we get to be the biggest trans-led organization here in Los Angeles. And, you know, we as an organization provide a multiplicity of services that are specifically designed and cater to transgender and conforming intersex people of all ages. Obviously, you know, just the makeup of Los Angeles, right? It's the population, the bigger population of the people who live in Los Angeles are Latinx people. So therefore, like by default, you know, the population of trans Latinx individuals here in Los Angeles is bigger. And so yeah, I mean, you know, we have reentry services, violence prevention services, legal services, violence prevention services, transitional housing. We, you know, and we also do policy, right? Because we believe also that we have to change the institutions that continue to marginalize us. And so, so that's what we do, and the work that we do. You know, I do have to say that even nationally, we as an organization have influenced the broader trans movement. And you know, I think it's important to also see, you know, the challenges that the trans people have, right? Like not just here in Los Angeles, but really across, you know, the United States, right? I think it's important to recognize that there's still a lot of work that needs to be done, specifically to support transgender and conforming intersex people. But certainly, you know, through these educational presentations, hopefully we can plant those seeds, and those individuals who have the power to create those changes could be intentional about creating those changes and use their power to better the lives of transgender and conforming intersex people.
Bamby, thank you. Thanks for placing food within a larger context of all that we need to be whole and healthy, including access to jobs that, you know, pay livable wages and safety from violence. One of the participants asked us to think about, you know, federal policy, like what federal policy changes could be helpful to lift people out of poverty, ensure that people have access to jobs and all that they need to live healthy lives. Olivia, I know you've been thinking about some federal policy issues lately.
That's the majority of my job, yes. One thing that's been really helpful with the current administration's approach to things, that we're seeing a very intentional approach to making gender marker and record updates more accessible across the entire federal government. The most obvious change was last year when we had the introduction of self-attestation on passports, no longer requiring any sort of medical certification, and eventually the rollout of an X marker on passports that we'll hopefully be seeing later this year. And seeing changes operating on this level in other parts of the federal government has been really reassuring to hopefully see processes and systems coming into place that will make things easier at the federal level for trans folks to update their records and to interact with these systems and processes, accessing the benefits that a lot of cisgender Americans take for granted.
Thank you, Olivia. So at this time, we're getting close to the end of the panel, and I want to give each panelist an opportunity to share a final thought about what's needed to reduce food insufficiency among trans communities. And it can be narrow in terms of the direct provision of food and how to better do that, or broader in terms of supporting healthy, you know, communities and healthy individuals, and what that would take. So let's go in the order in which we presented. So I'm going to start with Bamby and then go to Moses next.
Thanks, Kerith, once again. So what I believe needs to happen, and just, in the trans community, transgender, non-conforming, intersex individuals, really is an intentional investment in our lives, right? We need to really ensure that, that there's legislation and policies that are specific to uplift and better the quality of life of transgender, non-conforming, and intersex people, and really center on, people of color, right, and indigenous people. And so when we are able to really transform these institutions that have marginalized our community for centuries, really, then we are going to be able to transform and build healthy trans people. I think, food is just one piece, but I think we need to look at the broader aspect in a broader context on how we should support. I think we all have a responsibility to ensure that there's equity, and that there's equity in terms of like support and distribution of resources, but also to ensure that we have access to everything that we need to live dignified lives. So thank you again so much.
Thank you, Bamby. That sounds like a vote for the Equality Act, among other pieces of legislation that might help. Moses?
Yes, of course. And also, again, thank you all so much for having me here today. It's been a pleasure speaking with all of you. For me, I think broadly, we just need to recognize access to food as a human right, and one's ability to have unrestricted access to culturally affirming and nutritious food should not be based on one's ability to work and contribute to a capitalist society. If we're truly invested in the liberation of queer and trans BIPOC folks, we should be working to dismantle the oppressive systems and structures that prevent us from thriving and living our truest lives.
Thank you. Bria and then Bianca.
Sure, I'll say quickly that though we're in year 2 or 3 and hopefully the last year of the pandemic as we know it, the need is still great and folks are still in desperate need of healthy foods in their communities. So would encourage folks to donate, support their local food banks and agencies. And for those of us that are LGBTQ, be a volunteer, be visible, and that can be a small part of creating more accessible spaces. So thank you so much, Kerith.
Thank you. Bianca?
Yeah, thank you. It was great to join all these great colleagues and activism around food and economic security. I don't know, just following what Bamby said in terms of an investment in trans folks of color in particular, I think the other side of the coin here is to keep in mind, and this is related to one of the questions I saw in the Q&A with regard to youth, is remembering that many of our trans youth are still in their families and that they're coming from families that are also food insecure, also experiencing food insufficiency. So part of our investment in queer people of color's lives is also an investment in people of color's lives as a whole, and thinking about policies and services that are aimed at improving access to income, food as a right, as Moses mentioned, but not just in the LGBTQ space that's separate from the families and communities that people are coming from.
Thank you. Olivia?
The other panelists have really covered it well. Donating and supporting local trans-led organizations, and especially BIPOC trans-led organizations, is vital for the support and liberation of our communities. On top of that, I'd also like to mention that NCTE is going to be launching its next iteration of the US Transgender Survey in the middle of May. So we're really encouraging all trans folks who are able to pledge to or to take that survey, because that's part of what drives a lot of the information we'll have going forward. Knowledge is power, and knowing where the shortcomings are serving our communities is going to be a core step to knowing what we need to do next to better serve and uplift everybody within the trans community.
Thank you. Katie?
Yeah, keep it brief, which is find the thing that lights your fire. And if that is advocacy, talking to your legislator, amazing. If that is organizing with other folks who think and feel like you in your community, do that. And if it is right now, the thing I can do is write a check, heck, do that too. Find the thing that makes sure that you get involved, and think about how you can, be your little piece of the puzzle.
Thank you. Bringing it back to funding, I thank Conagra Brands Foundation for supporting this panel and supporting our research. Taking it back to funding, support trans-led organizations, particularly trans-led organizations that serve people of color communities. They often have ideas about solutions and should be part of the solutions to solve the problems that we're discussing. Many people who joined today are willing to provide some follow-up information and TA. And so I'm posting contact information for those folks here. Thank you again to the panelists for sharing what you know. I know you're busy and you do a lot. It's tremendously helpful to us and hopefully to other people. So at this point, I'm going to conclude our panel. Thank you and hope you enjoy the rest of your day.